Since we've joined ReFocus, we've had a lot of benefits added to our practice, just more support for our back office staff, whether it's billing, whether it's supplies, keeping the office staffed with what we need. Those things have been very helpful. Also, they've been really helpful with marketing endeavors and giving us more resources for those activities and helping us facilitate things such as lectures or CME talks for our local optometrists or other doctors where we give lectures and up to date on various aspects of healthcare and how we can share best practices amongst other practices. These have all been helpful additions since ReFocus has joined us.
Depending on the complexity of the condition or sort of what's going on, it takes different amounts of time to go over everything with patients. But I definitely like to first listen to the patient about what's going on with them pretty thoroughly. And then we go through that together. And when I diagnose them with something, I try to explain what's happening in a very clear way. I try to give them all their options so that we can work together to determine the best treatment plan. I always want to make patients feel like they're also involved, and I want to make them feel like they do understand what's going on with them so that whatever treatment that I recommend and that we decide to go forth with is more effective. I do try to take the time to explain everything as best as I can, but I always leave myself available for questions, and the patient can contact me anytime.
Within the tip of my fingers, I have access to multiple subspecialty doctors such as oculoplastics, cornea, so I feel really that I'm part of one team instead of being a sole eye doctor, which really allows for the continuity of care. So if I need to refer a patient to another provider, I can definitely talk to them directly, get their opinion, have the patient see them, and then have the patient see me back so we can provide the best all-rounded care possible. The ease of communication between different subspecialty niches is great for the patient because I can easily contact an oculoplastics doctor or a retinal doctor or a glaucoma doctor and have that care in-house. And that's better for the patient because we can share notes and things never get lost, and we can take real good care of the patient so that we're not just giving them a sheet saying, hey, you need to see a glaucoma doctor and never hear from them again. We can have that continuity of care.
I think the team collaborates well with patient care. For instance, we've had a patient who had high pressures, was having pain, was concerned. His doctor was in surgery that day, so it makes it a little difficult for us to see him. However, the doctor said, bring him in. So while the doctor's in surgery with his surgical team, the technicians works the patient up, triaged him just like we would normally do if the doctor was in clinic. When we were done, we let the front desk staff know. They talked to the surgical staff and was able to let the doctor know. So he came out in between his cases to be able to treat that patient, which I think not only shows that the doctor cares about his patients, but that the team as a whole was able to come together.
We get to really enjoy each other's company. There's a good culture. People seem to like to come to work, and that goes a long way, not just in my well-being as a doctor, but also in the well-being of patients. And it's really nice that I get to treat patients for their entire lives. And so I hope that in the next 20 years, I'm still around in the same area so that I could still be treating some of the same patients or patients' kids or family members. You have to treat each person as an individual for who they are and not just like as another number or as another statistic or as another disease that you're treating.